The FebriDx test is a rapid, 10-minute point-of-care test that uses a fingerstick blood sample to aid in the diagnosis of acute respiratory infections. The FebriDx test differentiates bacterial from non-bacterial etiology by identifying elevated levels of myxovirus, resistance protein A, MXA, and C-reactive protein, CRP. The FebriDx test is intended for professional use. The following items are included in the FebriDx test kit: 25 single-use FebriDx tests, 1 package insert, 1 quick reference instructions. You will also need a timer, gloves, alcohol pad, gauze, and a Band-Aid. FebriDx test procedure. An unused test device will show 3 faint orange lines in the result window. Tear open the foil pouch and remove the test just prior to testing. Cleanse the fingertip with an alcohol pad and allow it to air dry. Twist the protective lancet tab 90 degrees and pull to remove. Firmly press the lancet against the patient's finger and puncture the skin. Wipe away the first drop of blood with gauze and massage the entire finger from the base toward the puncture site to encourage blood flow. This will enable you to obtain an adequate drop of blood, which is key to running a successful test. Place the blood collection tube below the finger at a 45-degree angle below the drop of blood, without touching the finger. Fill the blood collection tube in its entirety by touching the drop of blood to the tip of the blood collection tube. Do not overfill. If the drop of blood does not completely fill the blood collection tube, squeeze the finger again and add more blood. Once the blood collection tube is completely full, lay the test on a flat surface and rotate the tube over onto the test strip until it locks into place. Confirm the blood has been transferred to the test strip. Blood should be visible on the test strip. Wait 5 to 10 seconds after transferring blood. Then activate the test by firmly pressing the buffer release button until it clicks. The buffer release button should be pressed within 1 minute of adding the blood sample. If no fluid is visible in the result window within 30 seconds, firmly repress the buffer release button until clicking is audible. Wait for at least 10 minutes for the blood to clear before reading the results. Results will appear in the result window. A blood fluid wave will continue to migrate to the blood clearance window. The blood clearance window is an additional visual control. If there is no blood visible in the blood clearance window, discard the test and retest the patient with a new FebriDx test. FebriDx test interpretation. Results should be interpreted at 10 minutes. If the blood has not cleared at 10 minutes, wait for the background to clear before reading the test results. Do not read the test results after 1 hour. A blue control line must appear in the result window for the test to be valid. The absence of a blue control line indicates an invalid result. If an invalid result occurs, the test must be discarded and the patient retested. The presence of a black line without a red line is a positive test result, indicative of bacterial infection. The presence of a red line with or without a black line, or no result line, is interpreted as non-bacterial etiology. Even if the result line is faint in color, incomplete over the width of the test strip, or uneven in color, it should be interpreted as positive.